Hey Devin, my name's Amy. I'm going to be your student nurse practitioner today. Can you tell me your name?
Devin.
Okay, is that what you would like to be called?
Yeah.
Okay. And what's brought you to us today?
I'm just having trouble sleeping.
Okay, so tell me more about that.
I can kind of, it's really hard to fall asleep most of the time, and when I do, I wake up a lot. I don't really stay asleep.
Okay. And how long has that been going on?
Close to a year.
Okay. How's your energy levels during the day?
I mean, some days are better than others. Some days I'll be more energized when I do more stuff. Most days it's not really like that.
Okay, so you're a little sluggish. And does it affect you at work at all?
It can, yeah.
Okay. How long does it take you to go to sleep once you're asleep?
Probably a couple hours.
Okay, so you just lay there?
I kind of lay there, yeah.
Okay. And then once you are asleep, are you waking up much during the night?
I usually wake up early in the morning, like a couple times throughout the early hours of the morning.
Okay. And then once you wake up early in the morning, can you go back to sleep?
Not immediately. It takes a while for me to kind of get back to relaxed, so
Okay.
I can.
Okay. And whenever you do get up and get ready for the day, do you still feel tired?
Yeah, like not really physically, but more mentally.
Okay. What makes this better?
I mean, I'll smoke some marijuana, and it usually helps me sleep. Maybe if I have a couple beers before I go to bed.
Okay. All right. And how much alcohol would you say that you drink?
Maybe 3 to 4 every other day on average, probably.
Okay. So about 3 to 4 every other day. And then, how much marijuana do you smoke?
Probably, I mean, not a lot when I do. It's probably one time a week on average, but it don't take a whole lot.
Okay. And then do you use any other drugs?
No.
Okay. What about tobacco or nicotine?
I have a vape. I hit my vape throughout the day.
Okay. Are you vaping at nighttime too? Before you go to bed?
Yeah.
Laying in the bed?
Yeah, it's usually beside me or on my chest, somewhere within reach.
Okay. So nicotine is actually a stimulant, and that might be causing you to stay awake. So you might can cut back that. Try not to vape while you're laying in the bed. See if that makes a difference at all.
Okay.
How's your appetite?
I usually eat lunch during the day, and I'll come home and eat something, just something small, but not a whole lot, really. I snack a lot more than I eat meals.
Okay. Have you recently gained or lost weight?
No.
Okay. How's your concentration throughout the day?
Pretty good. If I get started on something, I'm usually pretty good at finishing it in a timely manner.
Okay. And what do you do for a living?
I'm a mechanic.
Okay. How have your moods been?
They've been good.
Okay. Are you a little irritable because of the lack of sleep?
I can be some days, yeah.
Yeah. Okay. Have you had these sleeping issues in the past?
They've not been very prevalent when I was younger, but as I've got a little older, they've got a little worse.
Okay. Have you talked to your primary care doctor about it?
I've not.
So, have you ever been on any medications for it?
Trazodone and Seroquel.
Okay. And those didn't work for you?
Not really, and I probably just didn't give them a good enough time to start working.
Okay. Well, that's okay, because usually those medicines should put you to sleep pretty good if they were going to work.
Mm-hmm.
So if they didn't work for you, then the first few times that you took it for you to sleep, then there probably wasn't going to work for you.
Okay.
What's your bedtime routine? Do you have a specific routine that you follow every night? Does it differ every day?
It's pretty much the same. I mean, I'll lay down and usually put on a podcast or something and listen to it until I just kind of fall asleep
Okay.
as much as I can.
What time would you say you usually try to start going to sleep?
I'll lay down around 10:30, 11 normally, but
Okay.
I don't really get to sleep until 1 or almost 2.
Okay. And then what time do you have to get up to get ready for work?
About 6 o'clock.
Okay. So how many hours would you say you get of sleep? Like good sleep?
Good sleep, a good night, maybe 6. If I fall asleep earlier than normal.
Okay.
That's a good night.
Okay.
Normally.
How
4 or
often
5.
does that? Okay.
Not often.
Okay. Yeah, you really need a good 7 to 8 hours at least. So tell me about your health history. Have you had any other diagnosis like high blood pressure, diabetes, thyroid problems, anything like that?
No.
Not been diagnosed with anything? Asthma, nothing like that?
No.
What about your psychiatric history? Have you ever been diagnosed with bipolar, depression, anxiety, schizophrenia?
No.
Okay. Do you ever hear or see things that are not there that other people can't hear or see?
No.
Okay. And have you ever had any thoughts of hurting yourself? Like any suicidal thoughts?
No.
Okay. Any thoughts of hurting someone else?
No.
Okay. Are you currently taking any medications?
Not. I do have acid reflux a lot, but
Okay.
and heartburn.
Okay.
Also, do have ulcers in did have ulcers in my esophagus.
Okay.
I think that's what
You have
the heartburn's from. But I did have Carafate whenever that was a issue.
Okay.
But
you don't take it now?
no.
Okay. And you don't take anything for your acid reflux?
Omeprazole.
Do you take it on a regular basis?
No, just kind of as needed, more so. After I eat and know I'll have it or something, or
Okay.
when I know it's coming, I'll try to prevent it.
Okay. Okay. And are you allergic to any medications or foods?
No.
Okay. All right. Have you had any trauma in your life?
No.
Okay. No history of abuse, anything like that?
No.
Okay. And do you know your family history? Like are your parents healthy? Do you know their health history and your grandparents?
I know my dad and his dad both have high blood pressure, high cholesterol. My dad's mom has a low thyroid issue. My mom's mom has anxiety. My mom has acid reflux too, and she has anxiety. My mom's dad, he has high blood pressure, and he's had heart problems in the past.
Okay. And you mentioned some family history of anxiety.
Mm-hmm.
Okay. All right. Have you had any recent blood work done?
I've not.
Okay. I'm probably going to order some just so that we know your baseline. Because if I start you on any medications, I like to know your baseline levels just to make sure that nothing has been affecting anything. Okay.
Okay.
Okay. So your sleeping issues. We're gonna cut out the vaping while you're laying in the bed to make sure that that stimulant of nicotine's not affecting that. Okay.
Okay.
You mentioned the podcast, so that's good to listen to while you're trying to go to sleep. Is your room dark?
As dark as I can get it. Yeah.
Okay. You eliminate. Are you looking at your phone?
I got it on the charger on my nightstand.
Okay. And the TV's off.
Yeah.
Because the blue lights from your phone and the TV can affect sleeping as well. And your appetite's pretty good. You eat on a fairly normal basis.
Yeah.
And you've tried a couple of medications that didn't work for you. We're going to try a medicine called Dayvigo. And I'm going to put you on a low dose of 5 milligrams. We can increase that if it doesn't work. So I'm going to have you come back to me in a couple of weeks and we can increase that if we need to.
Okay.
There's also something that we can do for alcohol too, if you're interested. It's called naltrexone. It helps with the cravings. Do you feel like you crave the alcohol, or do you go through withdrawals or anything like that whenever you don't have alcohol in your system?
Oh no, I can go without. It's kind of a habitual thing more than anything. Just opening a beer. It's not the substance though.
Okay. All right. So I want to touch base on that again whenever you come back, just so I keep a check on that, make sure that doesn't get out of control, okay?
Okay.
There's also another medication called Vivitrol that we can do instead of naltrexone, so that we have options here if that ever becomes an issue. But Dayvigo usually works pretty well at putting you to sleep fast and lasting throughout the night, okay?
Okay.
We call it sleep hygiene, which is the routine of the bedtime routine is called sleep hygiene. So if we can get a good pattern here, that's what we're looking for. Okay, so does that sound like a good plan for you?
Yeah.
Okay, perfect. Well, I'll see you in a couple of weeks, okay?
Okay.
All right, thank you, Devin.
Thanks.